Okay. So I'm really excited to talk about this one, and I'm going to do a little like Q&A with Dr. Charlton here because he's further along and he's been doing this training longer than I have. But what we're going to be talking about today is retained neonatal reflexes. And the journey kind of started about a year ago. We were at a conference for applied kinesiology, and we met a doctor in Trent that's from out of Australia. In Australia, they've been working and developing this work for some time. But he did a particular maneuver on me because we found that it was showing up, and it's the fear paralysis reflex. And it was something I'd never seen before. Like he had do different work, and then he put me on the table, and he leaned the table back and did the long release on the occipital bone and the zygomatic arch. And the result of that is that I just felt like my whole nervous system kind of calmed down. And I was like, what is this? And why are you doing this? I later learned that that's a much more extensive version of what happens. And most of the time you do these with kids, but you do still see these reflexes exist in adults, and the work can be done on adults. And that's what he did with me. But so to jump into some of the stuff that we're seeing with it, because already the results have been really neat. One, let's actually start with that. Let's actually start, Ben, with what are some of the results that you've seen with kids as you've gone through and cleared some of these reflexes? And if you want to give a little more explanation on what they are, that works too.
No, that's great. Great introduction to the topic. A retained neonatal reflex is kind of what it sounds like. It's a reflex that we are born with. So neonate just means like a newborn, and a reflex is something that's automatic. It's an automatic response with a particular input to the system. And so retained means it's still there when it shouldn't be. And so a retained neonatal reflex is something like the palmar grasp reflex is the one that most people know. It's when you put the finger in the baby's hand and they squeeze it, and you think, oh, that's so cute, my baby loves me. But it's literally a reflex. You put it there, they squeeze. Just like in an adult, you tap their knee and they kick, right? If it persists, if it's retained later in life, it can cause problems like problems with handwriting, or things that you might notice, like you noticed with your daughter when she's doing fine motor skills writing, she clenches her teeth or bites her tongue. Like there's a connection between the hand and the mouth that should not be there anymore because the reflex is retained. So some of the things that I've seen so far in practicing this is kids who, like autistic kids, for example, that get dysregulated really easily. They can control themselves better. They're much more calm. They don't get upset about little things like they used to. A number of kids can read better now. They can, their eyes just work better. They can retain the information. They can read it without difficulty. And so they find themselves reading more because it's easier to them.
Yeah. And one of the things that just stood out to me in all these years of practice is seeing when we see something that has a change that happens very quickly, and then that change continues to hold, it really stands out to you. It's like, whoa, this was amazing. And so even my experience a year ago, I remember thinking after he went through this whole process and released that, I was like, surely that some of that anxiety is going to come back. I've always been someone that's, butterflies in the stomach. You can feel it in situations that might make you nervous. And I've always been someone that's just like, I'm just going to push through. And I'm going to do whatever it is and do it anyways. And after he worked on me a year ago, that calmed down, and it continued to calm down. In fact, I speak in front of people on a regular basis, and I've noticed myself get up and actually feel comfortable in those situations. And we're now a year later, and it was that one session. And so I don't want to overemphasize what can maybe happen, because there is a whole series of these that you go through and you can clear. But typically, if they've got it, that change you just described of an autistic kid being able to focus in more, that came after clearing one of these reflexes, right? It was one session,
Yeah, they started noticing the difference after that particular one.
Yeah.
While they may have other reflexes retained that are just not as big of a deal. And so you integrate those ones, and you might not notice as much change, but then that one is a big change.
Can be a big step.
But the one you're talking about, the fear paralysis reflex, that is a big one. And the symptoms of retention of that are butterflies in the tummy. So they might not like any new experience, or they may be shy, or they might have more avoidance behaviors. They might throw big tantrums sometimes too,
Yes.
but it's generally more of to get away from the stress.
Yes.
It's like an avoidance behavior. So avoiding new things, scary things.
Yeah, and so there's a list, and this isn't identified by this group in Australia. This is something that's like known in pediatric care, is that there's this list of reflexes that as we age should integrate, like starting as early, I think it was like 3 months or 4 months or something like that, right? With the
the fear paralysis starts at birth. It should
birth.
Integrate at birth.
So it starts integrating at birth.
Yeah, but
right?
a lot of other ones integrate around that 3 to 6 month mark.
And so, there's different things that can occur in people's lives, like traumas that times, physical traumas, emotional traumas, or sometimes we don't even understand why.
Right. Yeah.
Like it might not actually integrate, and so that system gets stuck on. So it's like you've always got that signal, like me with the butterflies in the stomach. And to speak to that a little bit more, like it was interesting to me because I've always felt that sensation until he worked on me. Doesn't mean I have zero anxiety, and I'll fully admit that sometimes still getting up makes me like nervous, but I no longer feel that like gut feeling, which is just stood out to me for the past like year, which is why I've like wanted to get into this and
That's
do
cool.
more with it.
And to expand a little further, the fear paralysis reflex, the reason you feel it there is because it's the vagus nerve. So you're releasing the vagus nerve as it comes out of the skull, down through the neck, down through the chest, into the abdomen. So that butterfly in the tummy, that's literally your vagus nerve saying, or having too much activity, actually, is what it is.
Oh, too much. That's awesome. Okay.
Yeah.
So then what are a couple of, because this stood out to me, and your and I's conversations, like you'd mentioned to me one, that kind of had to do a little bit with like the vestibular system. If you're someone that gets motion sickness like real easy, right? Like that's one that might be still activated.
Yeah, so they're the reflexes are broken up into the feeding reflexes or the mouth reflexes. And then you have your vestibular reflexes and then your postural reflexes. And you integrate them in that order. Our work integrates them in that order because that's the order that they should integrate naturally.
Yes, okay.
So you go through and do the feeding reflexes first because that kind of drives your more primitive movement patterns like hand, food, mouth.
Yes.
Or even before that, nipple, mouth, right? The rooting reflex, you stimulate the side of their cheek, they turn their head, open their mouth, and that kind of primes that movement pattern for nursing. Okay, so you work through those and then you get to the vestibular reflexes.
Okay.
And so one you're talking about is the sagittal or the tonic labyrinthian reflexes, which we break up into the sagittal labyrinthian and then the lateral labyrinthian. And the motion sickness one is the lateral labyrinthian. So it's a disconnect between what you're feeling in your inner ear and what your eyes are actually seeing.
Okay.
So when you tilt your head to the side, your vestibular system is saying, I'm tilted, but your eyes are not rotating a little bit to level themselves with the horizon. So you get a little bit of a disconnect to your brain and you get that motion sick feeling.
Okay. Now, some of them you can actually sometimes, visually see that reflex might still be engaged. We go through this training in order for us to help us like even identify when they are. But what's one, you mentioned to me like the Palmer.
Yeah, the Palmer, and that kind of goes along with the Babkin response too. It's the connection between the jaw and the hands. So the Babkin is when the baby is nursing, they tend to do this at the same time. So they have that jaw movement and hand movement connection. So when that's retained, and it goes along with the Palmer reflex.
So I saw that my oldest boy, you hear this a lot too, that they'll like play with hair, like the mom's hair, right? That's like that action too, right?
Yes.
It's like they're like doing something.
They'll pinch
they'll play the hair.
Yeah, so that's normal when they're nursing, right? But they should break that pattern. If they don't break that pattern, if they don't integrate it, then you'll see things like when they're cutting with scissors, they'll go, because they're using their hand at the same time. Or like your daughter, when writing, fine motor skills, typing, they'll bite their tongue or clench their teeth or some sort of compensation around the mouth area. Okay. So you can see that really easily if you have your kid do like this and do it real fast, or even like do your thumb and fingers like this real fast, and pay attention to their mouth also their hands. If they can't even do it, they might start doing this kind of pattern as opposed to this all individually. Or they might start flapping like this. They can't really, do that fine motor skill, or they'll start to clench their jaw or tighten their lips or something. They'll, do that.
Yeah. And so, there's several of these that have a visual cue that you have them do an action, and then you can like see it like that. I know another example that I've seen already is I'm going through this and working with infants and people. We had an infant that came in. They were around 6 months old, and it was the moral reflex. You could like see it. It's like the moment they became awake and kind of active, they started going into this extension reflex. And again, that's an example of one that should calm down. Like it's like this part of the startle response, and they go like this. And so it can become a difficult. One, you want that to integrate, but two, difficult with like an infant as they're trying to like sleep and they won't sleep because they're going back into this action all the time. And to speak a little bit to the correction process, which is really amazing about what these doctors have been able to piece together, is the correction process is a very like subtle process. It's most often involving the cranium and some of the cranial bones and the suture lines. Sometimes it involves like the sacrum. And it's like a soft pressure in specific directions would be the way to describe it. And so we went through that, clearing or helping the integration process of that reflex in that infant. And in just a very short period of time, that released, able to calm down, went from a baby that was very fussy and irritated all the time to calming down and taking naps and sleeping.
And two things about that. One, you're doing these releases, we're doing them with the body in the position of that reflex. So a lot of these reflexes have a body position because it's a reflex. So that startle position, we're doing the correction in that position, which helps to release better. Other point is that with that Moro reflex, that actually activates the sympathetic nervous system in the infant. Yes. And so that's how they're training their sympathetic nervous system. And so if that is still active, if it's retained, then every little noise gets their sympathetic nervous system activated. So they startle easily, they get angry easier. They have big outbursts and anger problems and things like that because they have all this aggression coming on because that's what their nervous system's telling them to do.
Like preloaded. Yeah.
Yeah,
it's
exactly.
Like preloading.
Exactly. Yeah. Which is so cool to understand these patterns and how they're affecting the kid, where it's not like the kid's not a bad kid, right? It's a reflex that they haven't suppressed, and so they're having all this adrenaline produced from noises, from sudden movements, and they're having to try to manage that the best they can.
Yes.
They're just not a bad kid. They
have
all this adrenaline going on.
The nervous system's like always hyper firing.
Yeah.
No, it's given me like a different like outlook. Is now like even when I work with clients or see clients and even people like around me, like I'm seeing these behaviors now, and I'm like, I had two other ones. One was an adult, one was a kid that worked on, and it showed up. Well, we go through that series, right? As you talk about the integration patterns, right? It's like first go integrate these and integrate these. And so it was a couple sessions in, and it's not even something we're even looking for, but it was the rooting showed up, and these two different individuals went through and cleared it. And one of the biggest changes that people around them saw was their sleep patterns. And so they went from people that would breathe heavily when they slept to not. Yeah. And, you look at one being a child, you're like, okay, but the other one was an adult that has tried to do different things to like fix that before. And it was, again, it's like one session, granted it was built up to, but it was like in this one event where you actually go through and do this clearing and integrate, and also the tongue positions differently. And
totally. And so you kind of touched on it. It's like you have to do this work to kind of get to that point because you're trying to rebuild their neurology in a way. You can't just jump straight to this thing if all these other pieces are not in place, because you can kind of mess them up. Yeah, they're not. It's like they're not built for it yet. They don't have that foundation. So you have to go through and lay the solid foundation to kind of rebuild or reboot the system in a way. The rooting reflex specifically, because you did it on me.
Yes, that's
and
right.
I didn't notice anything with sleeping. I haven't asked my wife, but
yeah, we should.
but I definitely noticed my tongue posture, my tongue position has changed. And so that's a common one to see after the rooting reflex, is that your tongue actually sits higher up and further back in your mouth, which is why breathing changes.
Why the breathing would change.
Yeah, because you're not blocking your airway.
Yeah.
Your tongue sits up where it's supposed to be.
Yeah.
It's so cool.
So it's just super neat. Super neat. So that's just kind of a little introduction into the retained neonatal reflexes. And there's lots of information out there. We started posting some different things on our blog just to kind of give people like exposure to what some of these reflexes are, like what it looks like when they have it integrated, and just their significance. And like you said, triggering sympathetic systems, triggering postural issues, triggering...
One more thing that's really obvious for parents that can see the big change after we start working on them. Eye tracking. So the eye tracking is huge. You'll see the kids, when you have them, follow their finger across like this, their eyes will just bounce around. They'll look this way, that way. They can't slowly follow your finger. And so in the beginning of the program, that's kind of one of the things we start with. And you can see it change on the table. Like from you have them track and they're jumping all around, and then you do the correction, and all of a sudden they can follow it nice and smooth. And the parents really notice that, and that helps with reading a lot.
Oh, that's probably the reading connection you were talking about.
Totally, because you're reading across the page, right?
Yeah. And it's all neurology. It's so cool.
It's very cool.
So so this kind of gives an introduction to that. Any other, if anyone saw this video and like had any questions, like please feel free. We always do consults, conversations with people, answer any questions that people might have in regards to this. And again, even for kids as they're developing, but even adults, like the work that we've done and seen already, and you've done several more cases of this than I have, but already like seeing changes in adults and the way that they're processing their environment and habits that they've had since forever, like mine with the butterflies in the stomach. Like I'm still just blown away by this. So
a friend the other day I did it for, and she said, dude, I can read better.
Yeah.
And her vision was she thought she's almost 40.
Yeah.
And she's like, I'm just getting older. My eyes are a little blurry, like going from near to far. It was like, took her a minute to focus. It just fixed it like that.
I like that.
Yeah.
Okay. There we are.